So my name is Ashwin Somasundaram. I'm a medical oncologist, specifically with a focus on GI medical oncology, and then a scientific interest in tumor immunology. The main patient population that I mostly see is folks with pancreatic cancer, stomach and esophagus cancer, but really any cancer that's associated with the GI tract. Certainly, one of the hardest things that I've noticed for most folks dealing with cancer is they still have a life beyond their diagnosis. And so a lot of it is actually spent making sure that they can live a rich, full life despite all the things that are going on, the things that we're asking them to do to kind of get themselves to where they need to be. And so it ends up being a balancing act between not just being an oncologist, but also taking care of a lot of social issues too. And that can be both tricky, but also pretty rewarding in its own way. You definitely, as an oncologist, sort of feel like you're a part of these people's lives as far as your patients are concerned. As an oncologist, you're there for them at easily some of the hardest times of their life, and they reciprocate that by just welcoming you into their lives and sharing with you some of their most vulnerable states. And that leaves a big impression on all of us, I'm sure. As far as my hobbies and interests outside of medicine are concerned, it's largely focused on nothing exciting, just trying to make sure that I find good places to eat, good books to read, trying to work on my golf swing, work on playing the guitar a little bit better. When I became a GI medical oncologist, I became very aware of how bad processed meat is for you. So that's one thing that I will definitely advocate, that people try to avoid processed meats, but it's really hard to give up Merritt's BLT. So there's BLT at Merritt's Grill, and I still love it even though I know I'm not supposed to eat it, especially as a GI medical oncologist. That's probably a fun fact for you.